Hello everyone, my name is Nicole O'Gale, and this presentation will be on working with children who have ADHD. We're going to go over a couple of things in this presentation. First, it's what ADHD looks like and the different types of ADHD that a child can have. We'll touch a little bit on ADHD in the brain, who is impacted by this, some prevalence rates, and what it looks like across the lifespan. We'll also look at related symptoms, why ADHD matters, and then ultimately some strategies to help support students with ADHD. Basically, this is the definition of ADHD. Persistent pattern of inattention, hyperactivity, impulsivity, and it interferes with functioning. So what all that means is that there's a bunch of symptoms that cause distress or impairment. And these are some of the symptoms that you might see. You might have children that are disorganized, off task, they are restless or fidgeting or talking a lot. They have hasty actions or they can't delay gratification. They might lack persistence when they are completing tasks in the classroom. So all of these can be observed and they can look like a lot of different things, but ultimately they can be grouped. So we see here red, blue, purple groups. They're all different categories based on similarities. And those similarities are 3 symptoms. We have inattention, hyperactivity, and impulsivity. Basically, with inattention, these kids can be quiet, they can look like they are distracted, they're missing instruction, they're missing their attention to detail, and they're not able to attend for longer periods of time. If they can attend, it takes significantly more effort to attend to longer tasks. They might be distracted by sounds or sights or smells, and it's really hard for them to make themselves pay attention. Hyperactive students, they require movement. They don't necessarily have to be climbing all over furniture. It can also be students who shift in their seats. They take longer when they're sharpening their pencils because they're walking around, they're taking more breaks, they're standing at their desk. In older students, we've seen this extreme restlessness, kind of an inability to calm down. Impulsivity is our last symptom. This can be in a bunch of different categories. So emotional, behavioral, or cognitive impulsivity. Emotional impulsivity could be impulsive feelings, so big reactions. You're quick to anger or quick to cry. Impulsive behavior, we see this a lot of time in our littler kids. So becoming physical, taking someone's belongings, darting out into the street. Cognitively, this can be making important decisions without consideration of the consequences, and that impulsive thought process. So you're handing your work in before checking it through, or you finish it really quickly and it's messy and you hand it in anyway. These are some of the regular symptoms that we see, and ultimately those are all symptoms of ADHD. Now, ADHD is somewhat different now than what we used to think of it. We used to have ADD and ADHD. So now we put in the umbrella term of ADHD. Everything is ADHD and there's just different subtypes. So we see here in purple the hyperactive impulsive subtype, and that means primarily we have that restlessness, overactivity, difficulty with regulation. There we're more impulsive and hyperactive. The blue is inattentive, so we more so have difficulty with paying attention for long periods of time, getting distracted, and hence some difficulties with cognitive regulation there as well. And then lastly, we have combined type, which means you meet criteria for both hyperactive and impulsive, as well as inattention. And so really when we're looking at diagnosis, it just means that you need to meet a certain number of symptoms out of a possible group of symptoms, and it has to be significant. Everyone is inattentive or restless at times. I'm sure every one of us has been in the past week even. And so when we're looking at ADHD, it does have to be significant over multiple environments to be considered for a diagnosis. When I'm looking at ADHD, it's also important to figure out things that it could also be that are not actually classified as ADHD. The first one would be culture or just normal behavior. So how different people from different cultures would rate a child's behavior, they could make it appear more or less severe depending on what they consider to be normal attention. That could also just be normal attention based on someone's age. You wouldn't expect a 5-year-old to attend for half an hour, and if they couldn't, that would not be abnormal. That would be expected for their developmental age. Medical, that would be things like hearing or vision. We always check these first. If you can't hear instruction or see the board, you're naturally going to be off task or not able to pay attention for a long period of time. Language differences are another reason. Language delays, or if you're an English language learner, that can be cause for poor attention if you're not able to understand what is going on in the classroom. Similarly, we have learning difficulties and children who have intellectual disabilities. School can be more hard for these students, more difficult, and they commonly have lower attention because of that. It would make sense that if something is extraordinarily difficult for you, that your attention would not be at 100%, much like if I went to a workshop on let's say astrophysics, I would not be able to pay attention for the whole workshop because it would be too difficult. Mental health also comes into play here. Anxiety, depression, naturally the attention would be lower in these individuals. If you have a stomach ache because you're worrying, or you have worrying thoughts that keep coming up into your mind, you have poor concentration, or you have sadness, you're not going to be able to pay attention like you would be able to if you weren't worried or if you didn't have depressive symptoms. So mental health can also mimic some of the symptoms of ADHD. The difference is when these are improved, we see better attention. So therefore, it's not ADHD. This is why we look at someone who is trained in this area to diagnose ADHD. When we're looking at who should diagnose, there's a bunch of different professionals that it would be suitable to ask. Psychologist or a medical professional are some of the top ones. At the board, we look for the impact on learning. So if we're unsure if it's ADHD or a different diagnosis, maybe attention is impacting learning, or maybe difficulties with learning are impacting their attention. So those are some of the questions that we ask at the school board, but those are just some trained professionals who are able to look at and appropriately diagnose ADHD. I am going to just talk about the brain a little bit. ADHD is a brain-based disorder. There are structural and functional differences with an ADHD brain versus a non-ADHD brain. And why this is important is that a lot of times it can be or can look like there's a lack of motivation or behavioral difficulty in children that have ADHD, when really it's brain-based. So a lot of it is not within their control, especially when they have not yet gathered the skills in order to help cope or manage their ADHD symptoms. Some of the brain differences are seen here. Again, structural and functional differences. Parts of the brain are smaller, less developed, or take longer to mature in someone with ADHD. The corresponding colors here just highlight some of the differences in the brain for someone with ADHD. You could see that frontal lobes are higher order thinking, executive functions, sustaining attention or being forgetful, difficulty planning, being impulsive or disorganized. That's some of the problem-solving areas that are in that frontal lobe, which matures later, takes longer to mature. Temporal lobe in green there, responsible for memory, emotional regulation, and the reward system. And so here we can see impaired memory or that difficulty with delayed gratification. So not being able to wait for a reward or praise, wanting that right now. We see that a lot of times in children with ADHD. The parietal lobe, we see difficulties completing tasks that students are not interested in. So that goal-directed activity and decision-making, you can't really persevere through something that you're not particularly interested in and set that long-term goal. It's more so about short goals that you can achieve immediately. Cerebellum, that motor activity, a coordination center. So that's where some of the hyperactivity comes in, and concentration there as well. We know brain networks are different with children with ADHD as well. They take longer to develop. They're often less efficient, which really causes the symptoms that we see in children with ADHD. Some research actually says that an ADHD brain may not block out some of the background noise or other stimuli that's not as important. So right now, if you are listening and you are hearing a clock ticking in the background, or your children in the background, or there's a dog barking outside, you can likely block that out and still pay attention to what you need to. Someone with ADHD may have more difficulty with that. They're not able to block out that background noise, so they're more aware of everything, which makes it much more difficult to pay attention. Brain chemistry is another part that's difficult with ADHD, or some differences. So neurotransmitters that carry messages across the brain cells, they can be less effective. Dopamine is the big neurotransmitter that we look at for ADHD. So that kind of that pleasure feelings, rewarding. So dopamine is related to. So sometimes there's not enough dopamine, especially in the brain reward centers. And with that, not having enough, an ADHD brain can crave that. So they try to increase their dopamine in other ways. This means they can engage in exciting activities or risky activities to try and increase that dopamine. That's why we see more drug use, more alcohol use, actually more craving for carbs. Aggressive behavior can also increase that dopamine, or risk-taking, like driving really fast. ADHD medication, sometimes families will speak with their doctor about that, and that's what that works on. There's part of the ADHD medication that works with dopamine in the brain to try and block that dopamine transporter that picks up excess dopamine. So it's just more available for use, more available to the brain, meaning that there's more dopamine in the brain, which is what is generally needed. With all of the ADHD symptoms, I wanted to give you a short video. I often get questions or concerns from parents with these quotes here that you see on the slide. So my child or the student can play video games for hours without moving, meaning I'm not sure if they actually struggle with attention, or they can sit through a whole movie, or if I'm right beside them telling them to do the work, then they can pay attention for the whole homework lesson. So on this, I just wanted to be able to show you a video that is right here. And it just looks at some of that, and then we will discuss it when the movie is done.
Hello, Brain. There's a lot of mixed messages out there about ADHD and video games. Do video games cause ADHD? Do they make ADHD symptoms worse? Or, my favorite, if my kids really can't focus, how can they pay attention to video games? Wait, how can we pay attention to video games? Why can we pay attention to video games for hours on end when we can't focus for long enough to finish half an hour of work? It's not because the work is harder. Have you seen some of the things kids build in Minecraft? It's not because learning is boring. I'm fairly obsessed with Duolingo. And it's not because we don't care. Well, usually. One of the biggest reasons video games hold our attention so well is video games provide instant feedback. Feedback is a response from the environment as a result of your actions. Everyone can benefit from feedback, but ADHDers thrive on it. According to Whitney Fosco, who led a recent study at the University of Buffalo, the major difference is that typically developing kids usually perform well even when simply asked to do their best. But kids with ADHD typically need an external or an additional reinforcement to perform their best. Given the right kind of feedback, some studies suggest that kids with ADHD can actually outperform their peers. And the more immediate, the better. Those of us with ADHD tend to live in the present, in the now. So if we do something well, rewarding us with our favorite ice cream next week will actually not be as effective as simple words of encouragement right away. Immediate feedback. Video games are all about immediate feedback because all video games are built on one fundamental principle, the feedback loop. The feedback loop has 4 parts: understanding the situation, taking an action, the application of the rules, and feedback, which leads to new understanding. In video games, this happens really quickly. Let's break it down. Here's how the feedback loop works. A game presents you with a situation. Say you're a kick-ass lady cop on the mean streets. Right away, you try to understand it. Okay, there's some arrows here, and you take an action. Let's press the forward arrow. Based on the rules of the game, you get immediate feedback, or moving, which encourages you to repeat that action, or, next enemy, reevaluate and try something else. Can I jump? I can jump. Oh, if you go up and then down, you get a giant butt. And you can stomp on enemies with. Stomp. The feedback that video games provide works so well for three main reasons. It's accurate, it's positive, or at least not judgmental, and it's immediate. Unfortunately, life doesn't always provide immediate feedback, and when it does, it's usually negative and judgmental. Timeouts, lost privileges, I just got slapped, boss is yelling at me and I'm not even sure why. Especially since we already tend to be hard on ourselves and get frustrated easily, negative feedback doesn't actually work that well for us. Not to mention the effect it can have on our self-esteem. Just like if you keep dying in a video game, you might decide you don't like that game. If you keep getting yelled at for your math test scores, you might just decide you hate math. Does this mean we should just constantly praise our ADHD kids or ADHD selves? No. That's the equivalent of pressing whatever button you want and winning no matter what. First of all, that doesn't make us any better at playing games. And second, I get boring pretty quickly. So what we really need is immediate, positive, and accurate feedback. Short of actually turning our lives into a video game, which you can do. I'll go into that in a later episode. How can we create a working feedback loop that motivates us in real life? If you are the one with ADHD, ask for feedback. Work with a therapist or ADHD coach. Ask your boss to let you know once a week how things are going. Start a YouTube channel and read the comments. There's a reason I've been able to stick to this longer than most things. Give yourself credit. The voice in our head tends to be pretty negative. Give yourself a pat on the back every once in a while too. Reward yourself. Recognize when you're making progress on things that are challenging for you and reward yourself. The actual reward can vary from getting to cross something off your to-do list to taking that trip you've always wanted after completing a big project. If you have a child with ADHD, consider using sticker charts. Make it a point to praise your child when they're doing something you like. Instead of just taking away privileges, try allowing them to earn rewards and experiment with it. It takes time for game developers to perfect their feedback loops, so don't be surprised when you find a few bugs in yours. In the beginning, your feedback loop might be too easy, too hard, the rewards might not be motivating enough or happen soon enough. Just remember, when game developers see their players fail or get frustrated or throw their controller across the room, they don't blame the player. They tweak the feedback loop. That's it for this week.
Okay. Sorry, I'm just going to go back here. Something I wanted to talk about was exactly what the video touched on. All of these things that attention can be difficult, but not all the time. So the video talked about frequent rewards for appropriate behavior. That's something that you might see where attention is actually pretty good in kids who have ADHD, or if they're under close supervision, or if they're doing something new and novel, they're engaged in something that they find especially interesting, or the biggest one with video games is that consistent external stimulation. So anything electronic, a phone, a TV, a tablet. In all of those situations, attention can be quite good. It's not that children with ADHD are not able to pay attention. In all of those circumstances, there's some mediating factors there that help to increase attention. You see less observable symptoms of ADHD. And that's one of the biggest reasons why kids can pay attention to video games for so long, and you don't necessarily see the ADHD symptoms come out in that circumstance. It's exciting, there's external stimulation, it might be new, a new game, really motivating for them, and you get that instant feedback. So those frequent rewards for the behavior that is displayed in the video game. Now we'll look at who is impacted by ADHD. In adults, we would have 2.5% and about 5% of children. So if you think of your current class size, we'll talk about 25 children, there will be 1 or 2 children with ADHD. That's about 5%. And that's in a typical classroom, not a specialized classroom, which would naturally be higher. We're talking about gender differences. There's typically more males than females who have ADHD, about a ratio of 2 to 1 in children, and about 1.6 to 1 in adults. Females are more likely to have primarily inattentive type, so that disorganization, unable to pay attention, forgetful, over the hyperactive impulsive than males are. This is why girls can be harder to identify as ADHD, and it can go undiagnosed because they are seen as those children who just quietly struggle in the back of a classroom. They may drift off, they may not pay attention, but they're harder to catch. The squeaky wheel gets the grease. We see that hyperactive or impulsive students, they draw more attention to themselves, so they're much more likely to be identified. When we look at ADHD across the lifespan, some different symptoms emerge depending on age. So in preschool, hyperactivity is mostly seen. When we go into elementary, it stays similar. We have hyperactivity, but attention becomes more prominent. So they're expected to stay seated for longer. They need to complete more desk work and more complex work. So you see that inattention really come up and be more important to address at that point as well. In adolescence, there is some impulsivity that comes up, and that would be over and above what we would see in typical adolescence. There's some fidgeting, that inner feeling of restlessness, not necessarily that same hyperactive symptom that we would see in elementary school. So just kind of moving around in their chair or feeling restless or impatient. In adulthood, we see inattention and restlessness, impulsivity as well. Hyperactivity typically has diminished by adulthood, but we do still see impulsivity more related to risk-taking, which can be a big factor that perseveres into adulthood. If we're still quite impulsive, that could be quite impairing in many circumstances. The academic deficits that we see accompanying ADHD are mostly related to the inattentive symptoms, whereas we see more social impact and safety impact, so injury, are most with symptoms with hyperactivity or impulsivity. Along with all the symptoms that we know about, so hyperactivity, inattention, impulsivity, there's a bunch of underlying factors as well. So many problems related to or associated with ADHD are not necessarily visible. Some of these are a result of ADHD, and some just contribute to the level of impairment as well. We see weak executive functioning. ADHD is a disorder of executive functions. Cognitive regulation, like we talked about before, behavioral regulation, emotional regulation. All of these are very difficult for people who have ADHD. Maturity is another one. We typically see a 3-year delayed brain maturation in those with ADHD. Sometimes parents or teachers will describe children in their class who have ADHD as immature or needing more support than others their age, and that's really due to that brain taking longer to develop and mature than others who don't have ADHD. We see sleep difficulties. That can be due to that hyperactivity, not being able to turn off your brain and really calm down at night, which can impact really everything else. If you can't sleep, you'll have a more difficult time the next day with regulation and attention. And then those same attention hyperactive symptoms make it difficult for you to sleep. So it's kind of that loop that makes a bigger impact for daily life. Learning problems accompany ADHD. Again, if you can't pay attention to the lesson, there'll be gaps in learning. You'll struggle more with academic content. Some of the behavioral symptoms are really underlying some of the ADHD symptoms that we see. So that low frustration tolerance, irritability, it can be seen as a behavioral problem, especially if ADHD has gone undiagnosed for some time. But really, those behavioral symptoms are a result of the ADHD symptoms. Hyperactivity, if you have to move around or you're restless, you're not comfortable staying still, you could be frustrated if you're having to sit for a long period of time. If you're impulsive, you can't keep your hands to yourself and you're hitting somebody, or you're really irritable because you have to complete a lesson that's difficult or very long for you. They're often seen as behavioral difficulties, but really they're underlying some of the symptoms of ADHD. And when we look at the symptoms of ADHD and address those, they help with everything that we see under the iceberg here. Now, part of that is not learning easily from rewards and punishment, which makes ADHD especially challenging, and we'll talk about novelty as we go on and some of those reward centers. Just some co-occurring disorders that accompany ADHD. You have a higher chance of having another disorder if you are diagnosed with ADHD. A couple of them are behavior-based, so ODD, oppositional defiant disorder, or conduct disorder, and these are really diagnoses of behavior. They're not like ADHD where it's brain-based. ADHD has brain-based, again, different functions, different structures in the brain. ODD is more of an outcome of something, and in this case, that something is ADHD. They can be irritable or angry or argumentative or defiant. And again, argumentative or defiant, if you're asked to complete a task that is seemingly never ending, very long or boring, you can be argumentative or defiant and not want to do it. You can be angry or irritable if you are emotionally impulsive and you are angry really quickly, or you get emotional very quickly from just being calm. About half of the children with combined presentation of ADHD would meet criteria for something like ODD, which is quite substantial. Conduct disorder, quite a bit less, but we still see these behavioral outcomes of students who have ADHD, again, looking at all those underlying symptoms that accompany. A specific learning disorder can also accompany ADHD, as well as other mental health disorders, so anxiety or depression, even substance use disorders. So substance use is more frequent among adults with ADHD than in the general population, and we will talk about that again in our next slide coming up. But there is just a higher chance of having another co-occurring disorder if you already have a diagnosis of ADHD. That doesn't mean you will develop a disorder. There is just generally a higher chance that it may occur. So why are we looking at this? Why does it matter? These are some of the outcomes that we see for ADHD. And this isn't everyone with ADHD. This is for those who have not developed the skills to cope with or accommodate for their ADHD symptoms. The educational employment outcomes, there's a higher school dropout rate. You're more likely to be unemployed or underemployed, have a lower wage. Relationship outcomes, more likely to have difficulties with their peers or their family, more likely to be divorced or have low self-esteem. Some of the more practical or daily outcomes, more traffic violations, more accidents, higher substance use. 15% of adults who have ADHD would meet criteria for a substance use disorder, which is quite substantial. Part of that comes from those increased risk-taking behaviors. We also have difficulty managing finances. So there's quite a big impact for adults with ADHD, which is why it's so important to provide skills and support to children with ADHD. So support, generally why everyone might be listening to this workshop. When we look at ADHD support, it is collaborative across settings. We want to make sure the family, the school, medical professionals, anyone working with a child, that they have similar goals, they have similar, I guess, communication styles, that they're wanting to communicate with the child in a consistent way. Even if things are different, we're kind of all communicating together to make sure we have the best interests of the child in mind. The interventions have a couple different things to consider. So education is the big thing, learning about ADHD. The people working with the child should know, but also the child should have an understanding of ADHD that is developmentally appropriate, but it gives them some background as to maybe why they're behaving a certain way or why they're learning the skills that they are, so that they're informed as they get older and they're able to learn new skills. The three interventions that we look at generally are environmental, behavioral, and instructional. Medication is not on the slide. That's generally a conversation between the family and the doctor. But these are more so what we can do in the school board here, change environment, do some behavioral strategies, and instructional strategies. The first one we'll talk about is the environment. And I talk about this one first because it's something that we can control. So everything within this section, well, it's wonderful to have the student on board. These are things that we can really do first on our own, especially if the student is new to learning some of these strategies, we can really help them out and support them so that we're taking away any of the barriers that come into play for their learning. The first is seating. Everyone knows about different variety of seating. It's especially important for children with ADHD, knowing that hyperactivity can be a barrier to learning. So we can have stand-up desks or wobble stools or rocking chairs. We want flexibility in the workspaces. We want location to be considered. Are they away from high traffic areas where people are handing in their work, or people are coming and going because there's an aisle close by or there's a door beside them? We look at separation when we want to complete independent work, so larger distances between student desks or separate desks. If we have a group classroom where we're sitting in a group of desks. The opposite for instruction, so we want proximity to the teacher, close to the board, or a positive peer when we want to work in a group or listen to instruction in the class. So making sure we have that space away from distractions when we're working independently and close to who we need to be listening to when we are trying to hear instructions or directions. Visuals are something that everyone is quite passionate about, and they're so important for children with ADHD. They let them know what to expect throughout the day, and they prepare them. So we can have visual schedules, again, posted in the room so they're easily accessible. Visuals for transitions kind of lets us know, and everyone know, when will the work period end? What's coming next? What will I need next? Where will I be going? All these things take time, and they're not necessarily considered by someone who has ADHD, so we can definitely help them there. We can have visuals for expected behavior, not just telling them, but showing them with a visual consistently what is expected of them can help with behavior. And checklists as well for required work, or what to do in a certain period of time, which questions are we working on, which pages are we reading, what do you do when you're done your work. These checklists are actually quite important for ADHD as well. The act of checking off something is very rewarding. We talked about that reward center in the brain and getting things accomplished and giving that feedback. So that checking off is actually feedback, and we will talk about rewards later, but checklists are actually quite powerful. Distractions need to be considered as well. We like to think that we can look at all overall classroom noise and control that. That might not be possible at the time, but something to consider. We can also look at other noises like clocks or heat vents that are in the roof. Is the student sitting close to those, and that's actually quite distracting? Are they close to windows, the door, high traffic areas? Maybe there's an aisle to the bookshelf where everyone gets new books during reading time. That would be very distracting. We can look to see who's around the child. Are the peers around them, are they positive peers? Are they also chatty ones that might need to have their own space as well? We can look at materials and belongings being distracting. What's in their desk? Is it all needed? Is it distracting? Are they one of the students who brings those small toys with them in their desk and plays with them? So we consider this when we're setting up really the ideal environment for learning. The last part of environmental is organizational systems. We can help set these up. For materials, things in a predictable place. Not necessarily where we think might be a logical place, and that students will understand because we think they're logical, but a consistent place that makes sense for them. So they know where their backpack goes and what goes in their backpack, what goes in their locker, where their pens and pencils are, where their workbooks are, where their textbooks are. This makes habits. They have a routine for something. They're an expected and consistent place, and that just takes some of the cognitive load off of them for the rest of the day. This is the same for access to materials across settings. So 2 sets of textbooks or online textbooks or an online calendar or agenda. That's just a consistent place to look if they're forgetful, which often people with ADHD are. So if they misplace their agenda or they don't bring home their textbook, there's a predictable and consistent place for them to find them online. Same for work. Similar places to hand in their work or to find new work or to find resources, just so that that's not a barrier for them to starting or finishing their work or to staying on task. We have to make sure these things that students are looking for are easy to find, they make sense, and that they are consistent even across courses, across different subjects if possible. It just creates a more predictable learning environment for the student. Behavioral strategies, these are more so strategies that we can do with our students. They really do need to be a part of the behavioral strategies to buy into them and want to use them, and it really helps to have their input into them as well. The first one, behavioral strategies for expectations. Everyone has classroom rules where we give reminders that we need to be kind to each other, raise our hand. These need to be consistently explained to children with ADHD. It's not necessarily enough to have the general classroom rules stated at the beginning and the end of the year. Reminders throughout that these are the expectations is very helpful. This extends to behavioral norms as well. And these are more so specific, where we have classroom rules are more general. These are very specific. They want to know exactly what's expected of them for each activity, each transition, and then possibly the consequences for misbehavior or not completing work. It's very difficult for children to predict when something is inconsistent, and therefore it's very difficult to learn from that. So if I didn't do my work today, would it be the same consequence as not doing my work next week? Or is the consequence that's being put in place just based on the time that someone has to think about it or the resources they have available? It is the most powerful when the child knows the consequences for the behavior before it occurs, and they could communicate that to you at any time because they know if they're not able to finish their work, this is what happens. Or if we have an unexpected or negative behavior, this is what happens. They're aware. And this is really important, proactivity. So we need to be proactive more so than reactive. That just makes the student more successful when we're setting them up for that success. Before the activities that are especially difficult for them is important. So we're setting them up for things like transitions or difficult work. It's much easier to be proactive and review what is expected of them before these tasks instead of going over what went wrong all the time. And it is wonderful to debrief and go over what went wrong and what can we do next time. Building positive habits and routine really starts with being proactive. So if there's a difficult situation, a difficult transition that's coming up, we make sure we go over what is expected during the transition and how they can be successful there before the transition occurs. Positive feedback. This is what that video touched on as well. We look for immediate, specific, and genuine feedback immediately following behavior. So typically it's positive, and we want to catch them being good. They may not remember if you give them positive feedback at lunchtime for something they did at 9 a.m. It needs to be immediately following the behavior, especially for an ADHD brain. It also needs to be specific. So we're labeling the behavior. If we say good job, what does that mean? What part was good? Maybe they're not sure. We could say something like, I liked how you stopped talking when I started to talk to the class. That's specific. Same thing with listen. Well, what does listen mean? How do I know if I'm actually listening well? We could say something like, I appreciate that you are listening. I could see you looking at me, your mouth is quiet, and your feet are still. That is specific and immediate feedback. The other part is being genuine. Authenticity is big, not being forced in what you're saying. Children can definitely tell when we're not being authentic, and therefore it's so important to catch them doing things that they're doing well, but making sure that these things aren't activities or skills that others can do very easily, because then it doesn't seem like you're being genuine. If I'm being praised for something that everyone can do very easily, it doesn't seem really authentic for me. And so, yeah, just being genuine, catching them doing things that you guys talked about and that you're working on is really wonderful. This kind of leads into the concept of selective ignoring. It's really ignoring minor misbehaviors to preserve the relationship. So ignoring when they talk one time during a lecture, but making sure that the minute that they are listening, we are giving them positive feedback on what we want to see. Typically, we look at a 4-to-1 positive to corrective speaking ratio. So 4 reinforcers or 4 pieces of positive feedback for every correction. And when we are making corrections, they're very short and simple before we move on. This can be very difficult for children with ADHD, where for those working with children with ADHD, because there's typically a lot of corrections. So we really need to catch them when they're displaying positive behavior and praise those small behaviors. We always want to acknowledge what we want to see, so much more powerful than correcting what we don't want to see. The reinforcement systems, this is a big area for ADHD. Again, consistent, predictable, those are big areas with a reinforcement system. And ideally, we'd like one that is slowly fading so that we can slowly fade away, allow the child to become more independent. Often with rewards, I hear, I don't want to reward behaviors because my child should be doing these activities or these behaviors anyway. It's part of their normal responsibility. So that's a normal reaction that I get. If the child is not doing a behavior now, our job, in my opinion, we have to jumpstart that behavior. And how do we do that? The ADHD brain requires more feedback, more reward, more reinforcement to be motivated. It craves novelty. The ADHD brain is just wired to want novel things, novel experiences. This is why so many reinforcement systems and strategies work for a period of time and then they don't. This is why drill and practice tasks are so difficult, homework and worksheets. The ADHD brain is looking for new activities. So we also have to look for new and engaging ways to practice skills. That goes to the reinforcement system as well. We want to build habits. The goal is that we don't need to use reinforcement systems for behavior. We want consistency. So when we're using a reinforcement system, we want to ensure the rewards are consistent. That really makes it a reward system and not a bribe. It's consistent and it's known to everyone. A reinforcement system might need to continue depending on the child for longer than we think, really due to the ADHD symptoms they have or the severity. Ideally, it can be phased out over time. However, as we just heard with novelty, the ADHD brain needs new things all the time. So it is quite common for reinforcement systems to need to be changed frequently and to be utilized longer than you would for a child without ADHD. Another part of that building habits is that we don't want to wing reinforcement systems. We want consistent rewards for consistent behaviors, which means full transparency. Everyone knows about the reinforcement system, including the child. And again, it's immediate, it's specific. We don't want to wait for a big reward after a long period of time. We might forget about it, and then we're not really reinforcing the behaviors we want to see. We can expect more after over time. So if you expect the child to listen for 5 minutes and they're successful there, and then they're expected to listen for 8 minutes and then 12 minutes before they are reinforced. This is over time, not necessarily after one success and then we're upping the expectations. It's really over time so that they are feeling successful. It takes time to build routines. We want to make sure that our motivators are simple, that they are easy to administer. If we don't have access to them or they need to wait for a long period of time in order to get them, they're not as motivating. And again, with ADHD, change motivators when they lose their effectiveness. That is what makes ADHD challenging to support. It craves novelty, which means we really need to change these reinforcement systems whenever they lose their effectiveness. For cueing, we really want to cue these children on what we want them to do, not what you don't want them to do. And wording is important in this. So A seminar I went to used similar sentences, directive sentences that worked like this. They started with, I need you to blank because blank. So, for example, I need you to stop spinning in your chair because it's distracting for me and I might forget what I was teaching. Or, I need you to raise your hand because when you have an idea and you call out in class, other people might be frustrated when you interrupt them. So this looks at telling the child what you need them to do and the reason why. It calls out what the behavior is, how it makes you or other people feel, and how it affects you or other people. It's specific, it's immediate feedback, and it has some positive wording on exactly what you need the child to do and the impact that they have on those around them. Also with wording, we want to avoid general language. So I need you to keep working, or I need you to pay attention. That can be okay, but just always keep in mind of what does that mean? What does pay attention mean? Maybe it means that we're stopped spinning in our chair and that our eyes are on the teacher. That can be something that is more specific and meaningful. When we're using cues, visuals, again, cueing to use visuals that are set up is helpful, or having other cues that lets the child know when they need to listen or when they need to work, like a hand signal or a visual or a word signal. This just helps foster independence so that we can slowly fade the need for full verbal descriptions and consistent reminders, and maybe we can just use a cue on letting them know what they're supposed to be doing at that time. Choice. Intentional options are important, and this just means giving the child a limited number of options that are quite thought out. So this gives the control to the student while still getting the required work done. I do this in assessment with students where I say, I give them 99% of the control because I don't need it. If we are completing a spelling task, that's my expectation. How we get that done, I'm going to be very flexible with that. So a choice in the environment, if that is an option. In class, we can do it in the classroom or in a separate room if there's a room that has less distractions. A choice in materials. Are we writing that spelling test with a marker, with a pencil? Are we writing it on the whiteboard? Choice in how work is completed. Am I going to put those words in bullet points? Am I going to write them and draw a picture beside them? Am I going to put them in slides on the computer? So we want to give them limited choices, about 2 or 3 maximum, because free choices are difficult to organize and choose from. And for an ADHD brain, those intentional options really produce the best results, where they're going to work, what they're going to use, how it's going to be completed. And flexibility is big there. If we're going to get some work done or we're working on a specific skill, pick your battles. Choose one goal to work on in the classroom. It can be different for all different students. Fare is not necessarily equal. We're providing choices, we're getting work done, and we're giving some of that control to the student. For the last practices here, instructional practices, and this can be for a teacher or anyone supporting a student, whether it's a full classroom or one-on-one. Consistency again, so going over schedules for the day or routines, or consistently checking in, giving an overview of the lesson, so what will be taught, how will it be taught, and kind of going over one-to-one with the child before the lesson. An example would be your teacher is going to teach math for 15 minutes on the smartboard, and then we're going to break into groups of 3. We'll complete a worksheet for about 20 minutes, and then we're going to come together as a class and go over the answers. That's providing an overview. It's consistency on what to expect. We know possibly how much time this is going to take, and now we're prepared for the task. That's something that's very useful for any child, specifically someone with ADHD. Combining modalities is also important. Lectures are so difficult for kids who have ADHD, including videos or songs or doing activities or experiments using manipulatives. These keep kids with ADHD motivated. Again, that idea of novelty, something new, that they can experience and really increase their motivation, and giving them time to practice new skills and explore those skills. Preferred and non-preferred activities, we want a mix of both of those, again, to increase motivation, especially when we have some co-occurring difficulties in school, difficulties with learning. Some students go from a non-preferred task to a non-preferred task to a non-preferred task, and that's very difficult for them, really with attention, but also self-esteem. So having a mix of activities that they enjoy, having a preferred activity in there, even if those preferred activities are just the absence of work, a preferred activity. We'll talk about breaks in a second, but making sure we have a good mix of those so that we are increasing our motivation for doing the actual work that needs to be done. Chunking work. Really, this is just deconstructing tasks, and it makes work manageable and able to be completed within a time frame. So we want to consider the student's age, their attention, and just provide work in sections for them with a goal. So something that they would be able to complete and be successful with in a certain period of time. We can give small works of small amounts of work at one time, and then we can always give more. So if you give 5 questions, once those are completed, we give another 5 questions. The most important with providing work in sections, the most important idea of this is having an endpoint. When the child knows that they're finished, that's what they're looking for. So many times I'm sure we've heard, how many questions do I have to do? Or when is math over? Or do I need to do all of this page? So we're really preparing them for the whole assignment and seeing that there's an endpoint in sight. There's a light at the end of the tunnel that they are working towards. It's not just 5 questions and another 5 and another 5. We know what we're working towards. The chunking work just makes it more manageable, but that there is a certain point in which we know that we have finished and become successful in our task. Providing samples and rubrics is also important. This ties into that having an endpoint idea. It's also a visual cue that they can refer back to all the time, how they know when their work is complete. It's also concrete and specific. They know exactly what is required of them, how much effort it will take to get there, and therefore they can plan their attention accordingly and not have an open-ended task that they're not quite sure how much attention they're going to have to dedicate to this assignment or this activity, which can make it difficult to even start. If they know ahead of time, because they know they have a sample in front of them on what a successful completed activity looks like, or rubrics on how they're going to be marked and exactly what they need, then they know when their work is complete. We always want to consider skill deficits when we're doing instruction, noticing what level they're reading at, what level they're writing at or completing math. Is the task appropriate for their current level of achievement? Often if we don't do the work, it's because there's something getting in the way. Executive functions are another big part of ADHD and often something that gets in the way. Executive functions are much too big to talk about in one slide, but again, think about regulation. So if we have difficulty regulating our cognition, we could have difficulty organizing belongings or ideas. We could have difficulty with working memory, so we're not remembering what we're supposed to be doing. Difficulty planning, we don't know how to plan our essay, so we don't know how to start. Difficulty with task initiation or completion, or even emotional regulation. If we're not able to regulate our emotions through the activity, we might not start it or might not try because we know that we're going to become frustrated with an activity of this length and we're not able to appropriately manage our emotions throughout the whole activity. We know that ADHD is essentially a disorder of executive functions, so they require much more support in that area. Often we ask the adults around them to be their prefrontal cortex outside of the body for longer than other kids without ADHD. Just help them with that higher order problem solving, all of those regulation skills. They need to be much more supported in this so that they're able to complete their work, and we're taking away some of those barriers to their work getting done. Checking for understanding is another good practice. Checking for their understanding of directions. So we can ask, what questions are you doing today? Or how long are you working for? Which questions were provided to you on the board? Materials. So what does this task require? Or what materials do you think you'll need to be successful? And we're really helping them problem solve here along the way, not just providing them with information, but helping them problem solve with you on maybe what they would need by just asking them some key questions. Content can be another area to check for understanding. This can be before, during, or after lesson summaries, and that really helps solidify knowledge by reviewing the key concepts. Repetition is really important for a student with ADHD. So we can ask things like, what have you learned so far? Or how did you get that answer? Or even, why was this information important? It really explains how their new learning fits with what they have learned or what they will be learning. And we're checking for a full and complete understanding and noting some of the gaps in learning. If they struggle with learning or struggle with certain executive functions, they might have gaps in their learning, and then we can note those and come back to them later. Again, visuals really accompanying some of the verbal directions. The two things that I like to think of are number and form when I'm thinking of the directions. The number being the minimal number needed to achieve the goal, one at a time if necessary. The form of the directions, are they in a place that's easily accessible? Were they given verbally and visually so that we can refer back to them? So number and form are really important when we're looking at directions. Here's the part about breaks. There's different types of breaks, body breaks, brain breaks. They're so important, especially for children with ADHD. Dr. Judy Willis does some great research with brain breaks. Her website is there. And really, scheduled breaks are important for kids with ADHD. They need the movement. They need their neural systems to reset and recharge so they can come back and be at a place in which they can learn. Brain breaks and body breaks, purpose and time limit. It's not just a passive activity that we're taking a break until we feel like we're ready. They're really, they have a purpose that we can set before the break and a time limit so that we know we do have to come back and work. But during that break, we can do mindfulness, or we can color, or we can listen to a song, something that is set before the brain starts or the break starts, or we can have a body break so we can walk around, or we can do chair push-ups, or we can do a task for the teacher. Those are some things that are really helpful. We can also suggest breaks when we see the student even starting to go off task, and make sure that the student knows how to ask for a break. If they're not going to raise their hand and ask for a break, maybe they need a break card or some other visual way to acknowledge when they're going to need a break before we're really getting into some of the behavioral difficulties that we see. As a general rule of thumb, for about every 10 to 15 minutes for elementary school children, they require a 3 to 5 minute break. For middle and high school kids, it's a little bit more, so about every 20 to 30 minutes, they require a 3 to 5 minute break. And the science behind this really is, for new information to become memory, it has to pass through a sort of emotional filter, the amygdala part around there, and it has to reach the prefrontal cortex. So if our brains are anxious or overwhelmed or tired, the amygdala in that area stops the information and blocks the flow for that to go through to the prefrontal cortex and memory. Brain breaks reset this, and they return the amygdala from a sort of overdrive state into an optimal state, which is great for information flow. So it allows that information to flow through again, which makes learning possible. If we're not taking breaks, that block really prevents learning. And even though we're still teaching and we're still practicing, we're not actually committing that information to memory. So it would actually be more powerful and more beneficial for the student to take a break, maybe even miss a bit of instruction so that they're able to come back and be ready to learn, where they otherwise might have just sat in class and not learned anything because they weren't able to take a break. Timers and transitions. Here we can create situations where children know the total time that they have to complete tasks. reminders and check-ins. When we look at timers, we're more so looking at progress monitoring and giving advance notice of transitions than anything related to a countdown. So we can say, well, there's 10 minutes left of this activity, or there's 5 minutes left, and then there's 1 minute left. You guys would know the children best, and so you use these as needed. And with each student, it might be different. It might produce some anxiety in certain students when you're giving them a countdown, so you might know that we can't use it with those students. It doesn't have to be a classroom-wide strategy. It could just be a subtle reminder to a child. We're not using countdowns to motivate them, but really we're checking for progress, and we're helping them with time management, which is so difficult for children with ADHD, and just giving them some advance notice on, oh, it's about 5 minutes left, maybe you should be around here in your assignment, and there's 1 minute left, you should be around here. And then noticing that if we're not getting the work done in the time limit we thought, it's not for corrective feedback necessarily, but just noticing it, that maybe next time we need more time, or we need to problem solve on what went wrong during that process where we didn't get the work done. Did we need help with planning or starting the task? Were we not able to regulate through it to actually pay attention? And using it as a problem solving strategy to be able to work with a student and figure out what went wrong. With transitions, again, really important to note and explain to the child so that they know what activity is coming next, reminding them of changes in location, changes in rules, changes in materials that they're going to need, so they know how to prepare for the next activity, and that they're given enough time to transition successfully. Technology is another area. Assistive technology is wonderful, not just for kids with learning disorders, but it really supports attention in kids with ADHD. It limits the amount that they have to do at one time. So a computer they can use, they could organize their thoughts on it instead of having to think of printing and spelling and the neatness of their work and whether or not they've remembered their pencil. The speech to text functions can help with written output. And a lot of the research really speaks to the complexity of writing, especially for students with ADHD and some students with autism as well, that it's just such a complex task, especially for those with an ADHD brain, more so than a non-ADHD brain. Other things like text-to-speech help with reading and proofreading, again, kind of monitoring their behavior and their work. Spell check, word predict, all of those help as well. For technology to work, it's really about doing one thing at a time and avoid multitasking. So for kids with ADHD, just as an example, you could brainstorm together on paper and then have the student type out their work. So they are more likely to actually keep with this task because of chunking, for one. The task is broken down. It's using planning as the first part. You can plan with an adult, plan with a peer, and then the work is typed up on the computer. So that's a separate activity. And it's really seen as two different tasks. We're chunking it and not one long one. And the computer helps with that it's just a different way of completing work. Our first one was on paper. The next one was on the computer. We've really broken up that into two completely different tasks. The student no longer thinks that this is one very long task that I have to plan and organize and complete work on the computer. It's doing one task, and then now I am switching to a new one. It's new, it's novel, that's more exciting for an ADHD brain. With technology comes the important conversation of supervision. It's important to stay on task when we have technology, and that is very hard for someone with ADHD. And this is where that consistent expectation comes back in, explicit rules around the use of technology, consistent all the time. They need to learn to practice these skills if they're going to use technology appropriately, and they need time to practice those skills. They may not necessarily use it appropriately all the time, but if there's consistent rules and expectations for using technology appropriately or not appropriately, then we're building those routines and habits so that eventually they will be able to use the technology available to them because it's such a wonderful support. I'd like to end with these two slides. Again, something that we can control. What are we doing in the classroom? Ideally, connecting, modeling, and regulating. It can be so much harder to connect with students who have ADHD because like I said before, there's so much more correction than positive interactions at times. If we can find ways to connect with these kids in a positive way, that will be the most powerful. Another thing is letting it go. Not letting small mistakes or misbehaviors interfere with the relationship. Again, that selective ignoring concept. It doesn't mean that you didn't see the behavior or that it doesn't matter. It just means that that student is so much more than all of their individual actions put together. Modeling positive behavior or problem solving out loud. So how did you get through a problem? When you were really bored, how did you think of ways to help yourself pay attention? And modeling that for the student. Regulating your own emotions. And again, this can be out loud. We're allowed to take breaks. We can be overwhelmed. We can need a minute to calm down before addressing a situation. Children need to know that we don't have it together all the time, but that we work on it consistently, and that's okay. We're regulating ourselves all the time. We're telling them how we're regulating ourselves, and maybe they will choose a positive way of regulating themselves as well, because they know that the adults that they care about and that are around them are doing something very similar. This last slide here, I like to bring up just reframing the behavior. The people who work with kids who have ADHD can really help everyone else in their life reframe that child's behavior and reframe the challenges that they're having so that they're better understood. It's that kids do well if they can. So Ross Green, it changes the won't to a can't. That won't is very stuck. Often you think the child won't do it. They won't do their work. They're not taking a break. They are not able to follow a routine. That is very stuck in that they just won't do it. It's that willful defiance. Can't is a very different outlook. It has that curiosity there. If they can't do it, it really sparks the question of why. Well, why can't they do it? What's getting in the way? And that leads to problem solving and how we can help them and how we can support them. So for example, instead of thinking, well, they should know what's expected by now, meaning they won't follow the instructions, we can try thinking, well, have I taught them the transition skills, which would be a skill deficit. They can't because maybe they don't have the transition skills, or they refuse to go to their calming place. We could try thinking, well, did I schedule enough proactive breaks before they were upset? Therefore, it's a can't. They're not able to regulate themselves, and we need to help them. These are just areas to, as we see at the bottom, find the stressors and reduce them, find unmet needs and meet them, find the skill deficits and teach them. If we can find a skill deficit, typically we're going to see those come out as behaviors. We can teach appropriate ways to do that. And again, reframing all this behavior from a won't to a can't is very powerful and helping kids with ADHD. The last slide I have here is just some ADHD resources, some online resources that I like to use and refer to. Some of them are about ADHD themselves. Some are about executive functions. Others are just some other supports, like there's some studying supports and some places to find maybe free sessions on a bunch of topics. Some of them may be ADHD, and then some print resources, some books at the bottom that I like to use myself. Some of these are going to be free resources, mostly the online ones. The print ones often need to be purchased, but just some of the resources that I like to use and refer back to. That is all for the ADHD presentation. Thank you for listening. And if you have any questions on this presentation, feel free to contact me.